Hello, my name's Michelle Hickin. I'm one of the cancer nurse specialists here at UHCW, and I've been asked to talk to you today about the long-term side effects associated with having a cancer diagnosis. Before going on to discuss these side effects, it may be helpful to discuss a few facts that illustrate just how common cancer is and what the most common side effects are, in the hope that by doing so, everyone can appreciate that you are not alone and that there is help out there, whether this is via your professional cancer team or support group, or indeed your nearest and dearest. Sadly, cancer is getting more common, with 325,000 people suffering side effects associated with cancer in the UK every year. We are now looking at 1 in every 2 people having a diagnosis during their lifetime. This was once 1 in 4, and that's not so many years ago. However, with the advancement of surgical techniques and oncological treatments, around 40% of patients go on to live well with that cancer, and for many, cancer can be compared to having a chronic disease. However, although many more people are living with cancer, its impact on treatment does not necessarily end with treatment when treatment finishes. It's reported that 500,000 people within the UK face side effects of one form or another, and this equates to 1 in every 4 persons. Of those who suffer side effects, 350,000 out of that 500,000 suffer from chronic fatigue. A similar number suffer from sexual dysfunction, and 150,000 people suffer from urinary problems, and a further 90,000 have problems with their bowels, either incontinence, frequency, constipation, diarrhea or bleeding. And there are 63,000 people who suffer from lymphedema. But the problems are not just physical. 240,000 people suffer from mental health issues as a consequence of their diagnosis or the treatment they've had and received. So let's look at these more closely. Certainly from my experience, fatigue is a very common problem, and it is particularly evident during the first year following treatment. But it can also persist for far longer, and 350,000 people, as stated previously, suffer from it. A national survey demonstrated that 43% suffered from fatigue up to 5 years following their initial diagnosis. So it is a significant problem that can affect your daily activities of living. The type of fatigue is not just a simple feeling of tiredness, but can be a complete feeling of exhaustion following the simplest of tasks, and it can be unrelated to having a good night's sleep. Moving on, a similar number of people expressed that they suffered sexual difficulties following their cancer diagnosis or post-oncology treatments, and these were both physical and psychological in nature, affecting 53% of men and 24% of women. Certainly having breast surgery, for example, or having stoma surgery, or indeed any type of surgery that leaves scars, can have an impact on body image. And this in turn can reduce one's confidence. Gynecological surgery or radiotherapy to the pelvis can lead to early menopause, hormonal disturbances, vaginal dryness, and then can impact sexual drive and the ability to have penetrative intercourse. And for some, treatment can lead to loss in fertility, and this of course has a huge consequence in terms of having a family. Surgery or radiotherapy to the pelvis can also result in erectile dysfunction. It is most important, no matter how embarrassed you feel, that you discuss your concerns with your healthcare professional. There is much that we can do to help. Mental health is something that we now talk about more openly, and it's no longer the taboo subject it once was. And I encourage you all to discuss just how much the cancer diagnosis is affecting you with your healthcare professional and the people close to you. Having some emotional alteration is entirely understandable given the enormity of what people face and the roller coaster of a cancer journey many of you take. And of those 350,000 we talked about earlier, 240,000 people of them suffer from some disturbance in their mental health, which can range from occasional anxiety episodes to full-blown depression and post-traumatic stress disorder. It is really important not to keep these feelings to yourself. We have access to superb psychological services, support groups, and if necessary, antidepressants may be needed, or more personalised care may be needed to help you through what can be a very difficult time. Moving on to yet another common problem, that of pain. Around 200,000 people complain of pain following their surgery, and for some, particularly those who have had abdominal surgery for example, this pain relates to adhesions. That's when parts of the bowel stick to one another. But it can also arise as a consequence of nerve damage, either as a consequence of cancer itself or by the chemotherapy or radiotherapy, which damages nerves in some cases. Peripheral neuropathy is a common problem associated with certain treatments and can lead to pain and also loss of function. It's associated, as I said, with chemotherapy drugs such as taxanes, platinums, vinca alkaloids, and can get worse the more treatment you have. It is mainly sensory, affecting fingertips and toes, and people say it's like having pins and needles or an intense buzzing in those areas, which can be transient to begin with and can be affected by cold. But the more chemotherapy you have, the more intense these pins and needles can become, to the point where if unchecked it can affect coordination and feeling. Peripheral neuropathy is usually reversible within a few months of stopping treatment, but for those who still have sensory loss 18 months or so after completing chemotherapy, this loss is likely to be permanent. There are a few drugs available that can help, so if it's something that's affecting you, I encourage you to talk to your healthcare professional. If you recall, I also mentioned that 240,000 people suffer from urinary and gastrointestinal problems. I appreciate when it comes to our waterworks and our bowels that we feel awkward discussing such problems, but I need to stress that there is much we can do to help. Having pelvic surgery plus or minus radiotherapy can lead to problems with urination or defecation, and these problems can range from urgency to incontinence. Compounding this is that some of the treatments we give to treat cancer can also cause changes in the way you process foods through your gut, which can then further impact on your bowel function. If you are suffering, no matter what the cause or what the extent is, speak to your healthcare professional. Lastly, there are 3 steps associated with finishing treatment. One is planning for it. Many people feel as though they've been abandoned when they're coming to the end of treatment, and stopping those frequent visits can be a daunting thought for many. I'd like to say that your team will always be there for you should you need them, and coming to the end of treatment often means being able to resume those things that you couldn't do before your diagnosis, so it can be an exciting time for many. But that likewise, as I said, it can be daunting, and discussing these feelings may help you deal with the longer term side effects. So please talk to your healthcare professional. It's also important to keep hold of those support bubbles and resuming those social activities you perhaps gave up during treatment. As professionals, we appreciate the difficulties you face, and we are there to support you throughout your treatment and beyond. There are, however, support groups should you need that kind of support. These are cancer site specific as well as general, and you may wish to join a hospice run programme, and there is of course the HOPE course. All of these courses are designed to support you while you recover from your cancer, but help you regain the confidence you may have lost and help you return to work, etc. Thank you all for listening, and may I wish you all the very best for the future.